Okay, we're going to get started. Grab your coffee, get a seat. We are the last panel of the day. My name is Joanna. I'm Executive Director of the Canadian Constitution Foundation. So the title of this panel is Charter Injustices and Strategies for Healthcare Choice. And just to give a 2-minute background for why this is the title of this panel, the Canadian Constitution Foundation became involved in the matter of healthcare choice and healthcare outcomes as a matter of constitutional liberty back in 2012 when we became involved with Dr. Day and his case. But really this goes back to, from a constitutional law perspective, the 2005 Supreme Court of Canada's decision in Chowley, in which then Chief Justice Beverly McLaughlin wrote that access to healthcare is not the same as access to a waiting list, and found that bans on private health insurance and dual practice, in fact, were an unjustifiable violation of Section 7 of the Charter of the Right to Life, Liberty, and Security of the Person. And we asked a simple question, which is, if that was the case in Quebec, why would that not be the case in the rest of Canada? And by the way, spoiler alert, we still don't have an answer to that after many painful years of litigation from our Supreme Court, unfortunately, but we're going to get into that today. And of course, my colleague, Christine Van Geyn, is a leading advocate for freedom in Canada. She's litigation director at the CCF. She is a host of the national show Canadian Justice. Okay, Christine, if there are any comments you want to share about the Court of Appeal decision, which of course came out, or both decisions actually came out when you were with us at the CCF, and both were depressing. But also at the CCF, what we're going to get into, but we think that this is still something worth pursuing in the courts. We think it can be part of a broader tactic of bringing about change. So maybe you could talk about what strategies we're considering pursuing to ensure healthcare choice in the future.
Sure. So first I'll talk a little bit about the Court of Appeal decision and the Supreme Court's decision to deny leave. And then I'll talk about what we're thinking about for the future. So there's so many aspects of the Court of Appeal decision that are just outrageous and wild when you think about the implications, because at its core, this is a case about rights. This was a Section 7 case about the right to life, liberty, and security of person. And the court, in the Court of Appeal, found there was a violation of the right not just to security of person, but the right to life, and that a deprivation of the right to life was consistent with the principles of fundamental justice because of this bizarre Rawlsian theory. And judges are not supposed to be social scientists or philosophers or legislators or policymakers. They are supposed to take the law and apply it. And in this case, they kind of confused their own role, I think. So the idea that a deprivation of the right to life can be, so if you're going to interfere with the Section 7 right, it can only be when that deprivation is consistent with the principles of fundamental justice, that means that the law cannot be arbitrary, overbroad, or grossly disproportionate. And it's just so difficult for any reasonable person to think of a deprivation of life that is not grossly disproportionate to almost any goal. And so that was two of the judges. The third judge said, yes, these deprivations are grossly disproportionate, overbroad, and arbitrary, but they are justified in a free and democratic society. This is the application of the Oakes test under Section 1, and that requires the deprivation be minimally impairing. And I cannot think of anything more maximally impairing than a government policy that kills you. But that's what the Court of Appeal found, the concurring judge found in this case. And then, because this is a case about rights, we all know that the Chowley decision was also decided as a case about rights, but instead of under the Canadian Charter, because of the way the division of the majority and concurrence was structured, it ultimately was under the Quebec Charter, which, by the way, the guarantee of these rights is essentially the same, but it was decided under the Quebec Charter. So the practical result is that people in Quebec have different rights from the rest of us in Canada. And I was actually at a wedding in Montreal about 2 weeks ago, where I was sitting at it was a lawyer getting married, so everyone at the wedding was lawyers. And I had a lawyer at my table. I was talking to her and her partner about this case, and just about some of the work that we do at the CCF, and this case came up, and she just didn't get it. They live in Montreal. She really didn't get it, and she's a lawyer, a commercial litigator, and she said, "Well, I just don't understand. If the wait lists are so long, why don't they go to one of the private clinics?" And I was like, because you only have those in Quebec. The rest, she literally did not know this. She did not know that how different the situation is outside of her own province. So now to turn to the Supreme Court's decision to deny leave. Joanna, if you've written about this in the Hub, you said cowardly is a word that comes to mind. I think that's accurate. I think that the Supreme Court in a significant way, perhaps has lost sight of its role. We have two glaringly inconsistent decisions about very similar pieces of legislation and the same sections of the Constitution, yet very different outcomes. And this is a case that goes to some really core issues. There has been no Supreme Court case where there has been a deprivation of the right to life that is justified under Section 1. This is a case that could have spoken to that, but I do think it was a hot potato case. I agree with you that was part of the decision, but frankly, dealing with hot potatoes and difficult, complex cases is the role of the Supreme Court of Canada. They have, as I said, sort of maybe lost sight of what their actual function is. I have some stats here from an article that came out last year in Law 360 that the Supreme Court output in 2023, that's the year that Cambie was denied leave, there were only 27 written judgments in that year. And that is the lowest output since 1947. So I think maybe less time at foreign judicial conferences and holding press conferences and commissioning busts, and more time hearing and deciding cases that are of public importance. So
not kidding, by the way. Chief Justice Wagner literally commissioned a bust.
We don't know if he commissioned it, but there is a bust of him.
There's a bust of him that you can go and see. Salute a great man at the Supreme Court.
Let me just briefly talk about some potential other strategies, because we are scrappy at the CCF. We do not give up. So we have been looking at an Ontario fact pattern. It involves sort of broadly similar laws to the BC laws that were challenged. I don't know if this is a silver lining to the Cambie decision being denied leave, but because it was denied leave and there's no Supreme Court precedent, it is not binding in Ontario. So we could bring another case in a different province and Cambie would not be binding. So we're looking at a case with a 45-year-old woman who waited for more than 3 years for her first appointment with a surgeon for a complex scoliosis surgery. And she applied to have her surgery done abroad. Ontario has this sort of safety valve that also existed in Quebec and was part of the Shaioli decision, which says if you have a condition and the wait list is too long, you can apply to have your surgery done outside of the province. But in Ontario, in the Health Insurance Act, that safety valve is only available if you're going to have, I think the criteria is if it's, like if you're going to die or have, I think it's irreversible tissue damage. And they said she's just in extreme suffering. So she's not eligible to apply. It's not good enough. She can suffer and wait.
Well, she's eligible for MAID. Oops.
She is eligible for MAID. So we could bring a challenge on the grounds that she is being left in extreme suffering, that this is a violation of her Section 7 rights, and we would not be bound by the Shaioli decision. I think perhaps if there were a number of cases with conflicting results, the Supreme Court would have a harder time denying leave. And I think that paying for the surgeries abroad rather than allowing for private insurance or extra billing, that would be a much better solution. It would be less absurd than a safety valve that pays for people to get surgery abroad. But of course, we know that absurdity is not a barrier for governments always. So that's one of the cases that we're looking at. We're considering working with this patient in a challenge.
What is the best remedy to judges committing sociology on us all? Well, of course, we have judges not just committing sociology, but also some type of junk philosophy with importing genres and stuff like that. And I think the answer to that has to be to hold them intellectually and professionally accountable for that.
I would add, to stop judges from committing sociology on us, we should stop appointing judges who think that they are sociologists. And I think a key route to achieving that is the work that the Runnymede Society does in law schools, which is to help train lawyers to understand sort of the role of lawyers and the role of the courts in interpreting and applying the law, not in creating policy or legislating and engaging in philosophy. So I think that that's some work that Joanna's been instrumental in.